Picture this: a hand, vital for daily life, suddenly under attack by an invisible foe known as flesh-eating bacteria. This rare but deadly infection, necrotizing fasciitis, can dissolve skin and tissue at alarming speed if not stopped. In Europe, where advanced healthcare shines, teams are ready to battle this monster through precise surgical intervention. Welcome to Medicare Tube USA, exploring how surgeons remove these bacterial invaders to save limbs and lives. It often starts innocently. A minor wound allows Group A streptococcus or other bacteria to invade deep tissues. Symptoms escalate quickly: severe pain, fever, and skin that blisters or turns black as the infection devours flesh. Diagnosis demands speed. Blood tests, imaging like CT scans, and biopsies confirm the bacterial assault. In European centers, rapid response is key. Delaying treatment can lead to amputation or worse outcomes. Treatment begins with powerful IV antibiotics to weaken the bacterial horde before surgery takes center stage. Surgery is the hero here. Debridement removes infected tissue, halting the dissolve and saving healthy parts. Under general anesthesia, the team incisions the affected area to expose and excise the necrotic flesh carefully. They remove dead skin and muscle like banishing monsters, ensuring no infected remnants linger to spread. Multiple surgeries may be needed, each session clearing more, guided by cultures to target specific bacteria. After removal, wound vacuums and dressings promote healing, while pain management keeps patients comfortable. In Europe's top facilities, hyperbaric oxygen therapy boosts recovery by flooding tissues with healing oxygen. Rehabilitation follows. Therapy restores function, turning a dissolved hand back to strength and mobility. Success stories abound. Early intervention means most patients regain full use after the surgical triumph. But prevention is better. Keep wounds clean, manage diabetes, and seek help for any unusual swelling promptly. Simple habits in daily life can ward off these bacterial threats before they dissolve into disaster. Europe's integrated healthcare systems ensure access to such life-saving procedures for all who need them. Remember, flesh-eating bacteria is rare, but knowledge empowers you to act fast and seek expert care. One survivor shares, "Surgery saved my hand. I can hold my child's again, thanks to skilled doctors." Innovations in Europe, like minimally invasive techniques, make removal safer and recovery quicker. From London to Berlin, specialized centers lead the fight against this formidable infection. The key takeaway: don't ignore symptoms. Early surgery turns the tide against dissolving skin. We've seen how bacteria monsters are surgically banished, restoring hope and health. Medicare Tube USA brings you these insights to inform and inspire across borders. Understanding the process demystifies the fear, showing surgery as a precise, life-affirming tool. Support from loved ones and medical teams makes the journey from infection to full recovery possible. Ongoing monitoring ensures no relapse, with follow-ups tailored to each patient's needs. Life after surgery, back to normal, with gratitude for the hands that healed. This is the power of modern medicine, defeating what seems unstoppable. Subscribe to Medicare Tube USA for more health victories and tips targeted for our European viewers. Share this video to spread awareness. Knowledge saves lives from flesh-eating threats. Thank you for watching. Stay healthy, stay informed. Medicare Tube USA, your guide to medical miracles worldwide. Until next time, remember, science and surgery conquer even the toughest monsters.